The 12 counties are staring at a possible paralysis in the health sector from Wednesday next week, following a resolution by health workers to down their tools over non-payment of salaries. 5 unions, the Kenya Medical Practitioners, Pharmacists and Dentists Union, the Kenya National Union of Pharmaceutical Technologists, the Kenya Union of Clinical Officers, the Kenya National Union of Nurses, the Kenya Health Professional Society, and the Kenya Union of Nutritionists and Dietitians have jointly communicated to the respective counties. We're now joined by way of phone Dr. Davji Atela, the Secretary General of the Kenya Medical Practitioners, Pharmacists and Dentists Union. Daktari, a very good afternoon to you. You're live on NTV. Your letter, while it states that health workers will not be going to work on Wednesday, also is quick to say that this is not a strike notice. So what exactly are we dealing with, Daktari?
Thank you, Ibrahim. Actually, this is a clear demonstration that the healthcare workers do not want to really go on strike. They want to offer the services. But a point has reached that they do not have the ability to actually continue offering the services because they are pending rent, they have the pending bills, they cannot afford to buy the fuels, and therefore it is impossible to expect the healthcare workers in those particular 12 counties to actually be able to report to work. Whenever they go to work in the state that they have been trying to, their mental status is not in the right form to actually offer the services. And therefore, we are calling upon these particular counties and the Treasury to ensure that these healthcare workers that are considered to be essential service providers, it is also replicate to their needs. Therefore, you see, it's not possible to demand and to expect them to be at work when actually this has not been done. And that's brought us to have a resolution that it is now the counties and the government to take actions and ensure that by 19th, these workers are paid. But if that fails, in any of those counties, then by Wednesday morning, not any of the healthcare workers, that is the doctors, the nurses, the clinical officers, the dietitians will be reporting to work until that payment is done. But in case any of the counties pays today or tomorrow or Monday or Tuesday, then it will be normal business as usual.
Well, Daktari, just to inform our viewers of the 12 counties quickly, we are talking about Kisumu, Mombasa, Nyamira, Kisii, Murang'a, Nyeri, Laikipia, Bomet, Nyandarua, Embu, Vihiga, and Taita Taveta. You have written a letter jointly to the governors of these particular counties. Have they given any response, especially given the economic situation? This is not a matter only at the county governments. We have also seen such a crisis on the national government this past week.
We had tried to engage even the Council of Governors and the counties over this particular matter, and there's a reality that they are also expressing their frustrations by the late disbursement from the Treasury. But you see, the particular counties that have made arrangements to prioritize the healthcare workers, they consider it to be essential service, and they've tried to get ways to have them paid. And therefore, it is also imperative for these other counties to look into the mechanisms to ensure that these workers are paid. I know the counties that are going to have overdraft by the banks, the counties that set aside some of the activities to pay these workers, because it is imperative to expect somebody to be at work when from the last month they've not been able to be at work. They've been able to get their salaries. And one thing that comes out very clearly, Ibrahim, is that most of these workers also have loans, bank loans. They have particular dates that they have to pay their landlords. So when that fails, you find that you'll be at work, and when you go back to your house, your door is locked. You will find that you've paid February salaries in the month of April, the way Kisumu did. You go to the bank, there's no money because all the bank loans have deducted this money.
All right.
So it is very difficult for any of these governors also to expect these workers when they know very well that Treasury has not released the funds. It is now for them also to put the pressure that the Treasury can release funds to have the workers actually be able to be paid.
All right.
Because it is quite now discriminatory in the sense that all other civil servants have been paid, except the healthcare workers in these 12 counties who actually ought to be at work to offer the services.
All right, Daktari, less than 10 seconds. Are we only talking about salaries for the month of March, or are we also speaking about counties which still owe monies for the previous months?
There are those who used to owe the previous month. They paid, I think, last week, like somebody last week. But then it is the money, the salary is a continuous process. If 1 month delays, it means that the previous month that was paid went into all those particular loans that are there for all these particular workers.
All right.
And also the statutory deductions that have been paid, meaning that these particular workers cannot even access the health provisions in these particular hospitals.
Thank you.
Because the NHIF also has not been paid.
Thank you. Thank you very much. That is Davji Atela, the Secretary General KMPDU, speaking about the crisis at health facilities across the country's 12 counties. To be particular, yesterday, the Chair, Council of Governors, Anne Waigoro, said the national government owes a cumulative of 125.8 billion from the month of January to April. But moving forward,